Are there any medication errors? Are we doing wrong side procedures? We track all that kind of stuff. We do that because we want to keep improving.
Right.
And unless we know what a deficiency are, we can't improve. And then this concept of joint venturing came up, where we're now tied at the hip with the hospital in terms of providing the service line that's hospital-based. And now I'm able to control workflow patterns in terms of because it's a volume-based business. It's not like these other practices where you have where you can charge a couple of $1,000s for a procedure. Here, our margins are much smaller.
Sure.
So it's a volume-based business. So how do you maintain patient safety without sacrificing patient safety, without sacrificing quality care? How do you manage patients through a process? So it took time to sort of figure out, from the time of a phone call for referral to the time a patient's discharged out of a facility, what's that process look like? How can we make that as efficient as possible without sacrificing safety and quality? And so it took a while to sort of get it to a point where I was really happy with it, where now I'm happy with the process workflow. And now I figured, well, if it's working here, well, it should be able to work in other areas, other centers, other locations. So the concept of PMG started there in terms of how to engage a patient, how to treat a patient, how to, quote, process that commodity through the system. Because for lack of a better term, a patient is a commodity, but it's a very valuable commodity, and you can't sacrifice the safety of that commodity or the way in which you treat that commodity.
Right.
So we had to make sure that we could provide the highest quality care that we could, and in trying to develop a program and having an informal way of checking my outcomes. Are my patients getting better? If I do this procedure, am I actually helping this patient? If I order this medication, is it actually helping this patient? So tracking these outcomes, I started doing that very informally. And then after we formalized PMG, we were able to build software in-house where we do track our outcomes in a formal way. So out of all of our centers, we have about 50 different locations of 50 different partners or so across 7 different states. And we're able to track our outcomes. We know how our patients are doing. If we do a certain procedure, are they getting better? If we order certain medications, is it being helpful? Are there any medication errors? Are we doing wrong side procedures? We track all that kind of stuff, and we do that because we want to keep improving.
Right.
And unless we know what a deficiency are, we can't improve. So if we have a provider who's sort of practicing outside of a practice paradigm, we'd have to have a discussion saying, hey, explain yourself. Why are you outside the box here?
Right.
Why aren't you playing within our box? So we have to, it's our brand. We can't have people being cowboys and doing whatever they want in terms of, for patient care. Number one, let's keep the patient safe. And so we know that we're keeping patients safe because we are tracking outcomes. We know who we're not doing well by. So we want to minimize that as much as possible. And, with this whole opiate epidemic, especially in Southern Ohio, we have over 150,000 patient contacts a year. And
Wow.
we have 0 accidental deaths from opioids. So it's
It's amazing.
It's absolutely amazing. I mean, we deal with high-risk patients in a high-risk field, and so we've gotten really good at trying to manage patients' opioid usage. Our goal is to reduce or eliminate their usage altogether by trying to control their pain with minimal pharmaceuticals. We don't want to use multiple drugs. So we try and find out where the patient's pain generators are, and then try and eliminate that as best possible, control it as best possible, minimizing the amount of medication they require. So all these things we track, and again, I don't know how to build software, but I know what we need to track to keep patients safe. And I just had one small concept in terms of, are my patients getting better with procedures? Are the medications helping them? Well,